A warm welcome to this webinar held in the frame of the Health NCP-Net HNN3. My name is Nicole Wies. I'm National Health Contact Point for Health at Research in Switzerland. And together with my colleague Sascha Hugentobler, also Health NCP, we will host this webinar with the help of our colleague Eva Bölund, who will manage the Q&A and the chat. And we are very happy to see you so numerous this afternoon. We will, in the next two and a half hours, we will provide you with information and tips on how to write a successful proposal. So give you advice, what you have to look at, which aspects you really have to cover, and give you tips and tricks. But we will not give general information about Horizon Europe or about open calls in the cluster health. And this webinar is recorded. If you don't want to appear, don't switch on your camera or microphone, but by default, your microphone and camera are switched off. The recording will be available on the HNN3 website after the event, and you will also get the slides. So you don't need to write too much, just to listen. And please ask your questions in the Q&A. If you look in the Zoom here, you have chat and Q&A. I have it at the bottom of my screen. And Q&A are for thematic questions about the content of the presentation. And you can upvote for questions that you would like, and in the Q&A session, we will answer in the ranking all the questions you ask. And please use the chat for technical issues only. Thank you. And content-wise, this afternoon, after a short introduction, we will tackle the 3 sections of the proposal template and look in more detail into the content and explain the excellence criteria. Then Sascha will explain the impact criteria, and we are very lucky to have a Swiss evaluator, Ariel Beresniak, who will share his vast experience as evaluator of health proposals. And after a short, well-deserved break, we will go on with the implementation section. Then we will have a general Q&A session where all the questions you put in the Q&A will be answered. And then Sascha will present the clinical study template, how and when to fill it in, because in the health program, this is an important aspect. And then the event will close at 4:30 Central European time. But before we start, I would like to shortly ask you who you are, and for this launch a poll. Let's see if it works. I'm looking at polls. I have 2 questions for you, and would be happy if you could answer where you are working, in which area, and if you are submitting for the first time to Horizon Europe, yes or no. I see answers are coming in. They're still coming in. I get you a few more seconds to answer. Good, I will end the poll. And do you see the results? Perfect. So, yeah, majority of you are working in academia, of course, hospital. We are happy also to welcome some of our NCP colleagues from Europe and beyond. And I see also that you are different in experience. Some are submitting for the first time and the other not. Thank you for your answers. I will now stop sharing, close the poll, and go on to the introduction. And would like to take the opportunity, as we are Swiss NCPs, to say a few words about the status of Switzerland in Horizon Europe, in case you have Swiss partners in your consortium. And as you may know, Switzerland is not yet associated to Horizon Europe, at least for the 2024 calls. We have the status of non-associated third country, meaning that Swiss entities should be added as associated partners to the consortium. They don't sign the grant agreement, and they get national funding by our federal government, the State Secretariat for Education, Research and Innovation, and not from the European Commission. We have a financial guarantee for the eligible calls with deadline in 2024 that can be uploaded and should be provided in the proposal. And if you need more details, feel free to contact us, or you find more details on our dedicated webpage. This said, I would like to start with the 3 golden rules for proposal writing. One important thing is really to fit to the topic information. Read carefully the topic text. Everything is there, and each word is important. Then address the evaluation criteria. We will come back to this, and follow the proposal template. So address evaluation criteria. This is important because you write a proposal that will be evaluated by external experts. And you have to convince them to give you the highest possible score. And communication with evaluators, a way of understanding what they will look at when reading your proposal, is to have a look at the standard briefing slides that the European Commission provides for evaluators. And there you get the points they are looking at. And when communicating with the evaluators, we recommend to be concise but comprehensive, to use a cultural, natural language and well-known universal concepts. Use visuals when possible. It's really nice to have graphs, figures explaining your concepts. It makes things interesting and more easy to understand. And make it interesting and create a consistent story. You should also follow the proposal template, which, as you perfectly know, is composed of 3 sections: excellence, impact, and implementation, where you answer the what, the why, and the how. And we will now go in more detail in these 3 sections. And I will start with excellence. In the first section, you will answer the what. What is the project about? And my main message, the two keywords I would like you to remember are you should dazzle and you should show the logic of your proposal. So you should dazzle your reviewers while building the logic of your proposal. You should show the overall need for and structure of your project. The more logic you are, the better it is. To do this, you should read the topic information. As said before, the topic text contains really important information, starting with the specific conditions, the expected outcome, and what is important for excellence is the scope, where you have the description of the background, the context, why the EC wants to fund autism or non-communicable diseases. And in the scope, they describe also what the project should deliver. And it is the basis for the objectives, methods, and work packages. You should also read the proposal template to follow it and read the definitions, which are useful. What is an objective? Well, what is a destination? What is outcome and impact, for instance? The template is structured in two subsections: the objectives and ambition on one hand, and the methodology on the other hand. Then you should also read the evaluation criteria, because this is what the reviewers will use to score your proposal. And on the one hand, they will look at the clarity and pertinence of the project's objectives. They will look how your work is ambitious and goes beyond the state of the art. And on the other hand, they will look at the soundness of the proposed methodology, including underlying concept and models. And there are other aspects such as interdisciplinary approaches, appropriate consideration of the gender dimension, open science practices, and how you engage with citizens, civil society, or other end users. Once you have read all these different parts, you can start writing. You should merge the requirements in the topic text with those in the proposal template. And let's start now with the subsections. 1.1, objectives and ambition. You should show why the objectives are pertinent to the work program topic. And really important is that you make them measurable, verifiable, realistically achievable. In other words, SMART. And SMART stands for specific, measurable, achievable, realistic, and time-bound. And you should describe how your project goes beyond the state of the art. And how will you do this? By examining the existing literature, but also screening existing projects. For instance, you can go to Cordis. This is a database from the European Commission about past and current running European projects. And there you can see what has already been done. And if relevant, you should also search in patent databases. So tips are to show how your objectives are related to each gap in the state of the art you identified. You should highlight the main objectives in a clear way. It's really nice if you have bold or bullet points so that the reading is easy and main objectives are quickly identified. And you should structure your project around your objectives. So in summary, the tips, The structure should be clear and logical. You should have enough details to convince the evaluators, and include links and synergies to other European programs, but always highlight the added value of your project compared to those. And in health especially, the social sciences and humanities are an important aspect. For instance, the two-stage topic, Stay Healthy 10105, you have in the topic text the sentence, this topic requires the effective contribution of social sciences and humanities disciplines and the involvement of SSH experts. And here you have a link on good practices and examples to help you. Then the subsection on methodology. Here I will say something about open science practices, the do no significant harm principle, and the gender dimension in the research and innovation content. So open science, it is mandatory to have open access to research outputs, for instance, through deposition in trusted repositories, but you also should show the research output management. We'll have to provide a data management plan and show the measures you ensure, where you ensure reproducibility of research outputs. In addition, it is recommended to participate in open peer review, to have early and open sharing of research, for instance, through pre-registration, preprints, or crowdsourcing. And it's also good to involve all relevant knowledge actors in the co-creation of the research and innovation agenda content. The data management plan is a project deliverable at month 6. It should be regularly updated as the project progresses. It will be evaluated in the proposal. And if you are looking for templates, the European Commission has provided some, but you are free to use any. And open science is an evaluation criteria in the excellence section. So here are the different aspects that will be looked at, how the open science practices are implemented, how they are adapted, and evaluation of the research output management and related plan for other outcomes than publications will also be looked at. Additionally, it will be also looked at in the implementation section, in the quality and efficiency of the implementation. So it's really worth to think about and have details about open science. Then do no significant harm. This is a new aspect in Horizon Europe. It is still something even experienced NCPs struggle with. You have to explain how the negative impact could be managed if it impacts climate change mitigation, adaptation, the protection and restoration of ecosystem, the sustainable use of water, the transition to a circular economy, or pollution prevention and control. And this has to be addressed both in the excellence and in the impact part. But evaluators score the do no significant harm principle only if explicitly stated in the work program. So we can ask Ariel Beresniak later, in his experience, how he deals with this, but it is important to know that it exists. The third element I would like to stress is the gender dimension in research and innovation, because when we NCPs review proposals, we see that it is often weak. And one important point is that this section is not about the gender balance in the team carrying out the project. This is also an important aspect, especially when it comes to ranking of proposals with the same score. Consortia with a balanced team will get a higher score than those who don't. But here, the gender dimension in research and innovation is another aspect. You should reflect on why sex and or gender could matter in your project, in your research. And for instance, especially in health, we know that, as an example, the symptoms for stroke are different in men and women. And you should take this into account when you make your prevention measures, when you design a device, or if you include patients. You should also consider the production of new knowledge on gender, or include sex and gender aspects as part of a multidisciplinary approach. You can also consider social categories, factors intersecting with sex and gender. So this is something which is important and should be thought after. Here, in the frame of the HNN3 project, we analyzed several ESRs and looked at recurrent comments from evaluators. And I show some examples here. Often, they criticize lack of sufficient in-depth description on individual objectives, or not sufficiently detailed information on number of data sets and patients for some of the clinical sites. And measurable key performance indicators are missing. Other comments: the description of the necessary upscaling of results from pilot areas is vague. The strategy for patient engagement is not sufficiently clear. And the last comment about co-creation and other practices to involve citizens, in particular hard-to-reach groups, have been described with limited details. And there you lose points if you don't address it. And therefore, these are recommendations. You should design quantified objectives with clear metrics. So key performance indicators. Give details about what you want to do, how many patients will you include, by when, to convince the evaluators that you will achieve your goals. You should address all topic requirements listed in the topic text. You should make the structure really logical and clear, and describe in detail how to engage with stakeholders. This is a point really more and more asked for. It is also so not only social sciences and humanities, but other kind of stakeholders, patients, patient groups have to be included and involved. On the other hand, don't have too many objectives, and don't omit reference to relevant publication patents, but also EC initiatives or other mentioned policies in the topic text. With this, I'm at the end of the excellence part, and we'll be happy to give the word. I will stop share my presentation. We're happy to give over to Sasha.
Welcome. Good afternoon from my side to everyone. I hope you can see my slides. So after this part from Nicole, I have the pleasure to share with you the impact section. We will look at the impact section of the proposal, what you need to have in mind when you write this part, and that you know on what criteria it's evaluated, and what are the most frequent criticisms from the evaluators. Before I give then the word to Ariel Beresniak, the evaluator and also coordinator from Health Projects, that will share his experiences. But first of all, the impact. What is that? As Nicole already said, the impact answers the why. Why should we do the project? And why, what evidence do we collect and measure to demonstrate the project's value? So the impact section is wider than the scientific section. It's the impact overall of the project. And because of that, there is 3 sections that you will have to answer. You will have to convince the evaluators first the project's ways towards this impact that you will spell out. You will also show how you measure what the measures to maximize the impact, what kind of dissemination, exploitation, and communication activities you will carry out to have an impact. And then at the very end, the 3rd section of the impact part is a so-called summary, a canvas that brings the quantifiable indicators of all this together. And just to already mention, this summary part is extremely important. It's very often are these canvases used when there is 2 equally strong proposals to see which one has the stronger score in impact, because it's a nice summary of the whole impact section. But we will look at that later on in more detail. So I already mentioned impact is wider than the scientific impact. So what is it? It's the wider and the long-term effect of your project on the society, on the environment, the economy, and on science, enabled by the outcomes of research and innovation investment. So it's what your project will have of an effect in the society or in the environment in 5-10 years' time. In order for you to justify your arguments in the proposal, they need to be measurable and quantifiable. You need to put figures on them, that it's believable that you believe that you achieved this. And you need to go further. You need to show what evidence you collect and measure in the project to demonstrate these impacts. And if you want to show demonstrate an impact, you need to also show to whom you have this impact. So the target groups or the end users or the patients. You need to show how they are engaging with the project and with the results you create, what role you give them, and how you measure their engagement. As an example, if you develop a new therapy, how you reach the patients that are targeted for this therapy, how do you involve them, how do you measure their engagement, how can you prove that this is going to be taken up and this is really value to these people, to the end users or to the society. So for that, the Horizon Europe program has a keyword, a buzzword, the key impact pathways. These key impact pathways should show how you come from your results in the project over communication, dissemination, and exploitation. We look at that in more detail later, how you reach these impacts. And these impacts have been defined for the entire Horizon Europe program, regardless whether we are talking about food research, health research, transport research. The impact that every single project should achieve is scientific impact, societal impact, and economic technological impact. And maybe when you are in the middle of writing your impact section, take this table out and have it beside yourself and ask yourself, are you convincing on all these 9 key impact pathways in the 3 different impact areas? Let's have a look at it together with some examples. So let's say you are working on development of a new vaccine. So as an example, you create high quality new knowledge, you strengthen human capital in R&I by having postdocs or PhDs and other scientists working on this. And you foster diffusion of knowledge, open science with conferences, publications, and so on. That is easier for us all as scientists or ex-scientists. But now let's have a look at the societal impact, what you need to have convincing arguments on. So you need to show that you address EU policy priorities. I can assure you every research addresses EU policy priorities. Let's say an EU policy is to eradicate a certain disease. Then any vaccine that will work or any work on a specific therapy or treatment will work towards that goal, and that's what you have to show. Delivering benefits and impacts via research and innovation missions. Of course, any new findings that help patients, that help in the lab, that help on the market, drugs, therapies, diagnostics, they deliver benefits for the society or specific patient groups. And you can show that in figures. You can come up with how many people are benefiting, how big is the market, how many patients can benefit from this. And strengthen the uptake of R&I in society, as I just mentioned, by services, trainings, therapies, or drugs on the market. Then you also have to show the economic and technological impact of your project. There, the examples that you should address and think about in your project is generate innovation-based growth. So if anything can be exploited, have you a company in the consortium that can raise market share or can go across different borders to sell their products or services? Create more and better jobs. When a company grows, then they can create jobs and that way leverage investment in R&I. These are the pointers that would be good if you had them at hand when you write the impact section, and force yourself to think of the parts that you may need a bit more time to come up with justification how your project has an effect. And national contact points in your countries are here to support you in this. Now, the impact in the proposal template has the following text. Proposals must include a narrative explaining how the project results are expected to contribute towards each of the outcomes. The outcomes are in every single topic text of an open call. The outcomes are spelled out. You need to show how you have an effect on these outcomes in a measurable way. And ideally, these outcomes should be that you have an impact in these areas towards the end of your project latest. Of course, to show the impact, you also have to show that you reach the target group, that there is an end user group that will be benefiting and that they are interested in the uptake and how they benefit from the outcomes that will be achieved in the project. There is a longer term impact that you also should show in your project, and these are called the wider impacts. So the project's contributions to the topic's outcomes must lead in the longer term, we talk about 10, 15 years, to the wider impact listed in the work program. And where can you find these? Because they're also provided to you. You don't have to find them out yourself. In the work program where your topic is, so you find the topic on the funding and tender portal, but all these topics are also called in a work program, and each work program has different sections. And at the start of the section is the destination, and the destination explains on 1-2 pages what the overreaching, the wider impacts are, what the goal is, and why budget goes into these topics in the long term, what the justification was. So, for example, to save health costs or to have less of a burden on the economy, or in the cancer mission, it's to reduce deaths and suffering of cancer patients. And these are the wider impacts that you need to address. If you can't find these chapters of this work program, again, we are here to support you in every country we are. Let's have a look at what evaluation criteria, what criteria are used to look at your text in the impact section of your proposal. There is 3. It's the credibility of the pathways to achieve the expected outcomes and impact specified in the work program. So how well you showed how you come from your activities to your results and then to the impact via the targets group of your project. And it goes further. The evaluators also have to look at the scale and the significance of the contributions due to the project. We look at that in more detail later on. And also what they're asked to look at is the suitability and quality of the measures to maximize expected outcomes and impacts, as you set out in the project, in the dissemination and exploitation plan, where you also include your communication activities. And we have quite a few slides on that, as this is extremely important for you to understand how it's being evaluated, that the evaluators can judge whether you will reach this impact by the activities you are doing. So as Nicole, I'm coming back to the impact section in the proposal template. You have 3 parts. You have the project's pathway towards impact that you need to write, the measures to maximize the impact, and this summary, this canvas. The first part describes the contribution of your project results towards the outcomes and the wider impacts. We already looked at that. It has another part. It has that you have to show the requirements and the potential barriers. What does that mean? You need to be aware of the requirements that you have, and that means on the regulations that are in the different countries in order to implement, for example, a new app that is based on AI or a new survey or a clinical study. Every country has different regulations and you need to be aware of them, and you need to show the requirements that your project has to fulfill in order to be able to carry the work out in the different countries. That goes with the barriers as well. You need to be able to define, identify the barriers and show mitigations, how you overcome them. Now we come to the part that I said that the evaluators have to evaluate as well in this part. So that you have to indicate the likely scale and significance of the project's contributions to outcomes and impacts. What does that mean? The scale refers to how widespread the outcomes and impacts are likely to be. We are looking with an example at this in a minute. The significance refers to the importance or the value of those benefits. So let's say there was the COVID pandemic and there was calls on rapid testing. So the scale there refers to how widespread the outcomes and impacts are likely to be. That time it was across all Europe, across the globe. So the scale is big. The significance then refers to the importance. The importance of testing is high. The value is high, so you can show that. Whereas the significance, for example, for a vaccine to prevent people from dying is also of a specific size, of a specific importance. So the significance and the scale, think in your field how big this is compared to other examples, and then give it a size. Try to have an indication of size on this. 2.2 is the measures that you are using, the activities that you do to maximize the impact. And there in the proposal template, it says a first version of the plan for the dissemination and exploitation, including communication activities, is required at the proposal submission stage. We look at that. And that, of course, goes together with the target groups, who you reach with which activities, which dissemination and exploitation activities. And beside all that, and linked to the exploitation, you need to show quite in detail the strategy for the management of intellectual property. And this is not only the intellectual property that you publish or that you have patents filed, but also how you exploit these results. This program, the entire Horizon Europe, has a goal to bring as much research as fast as possible to the society and to their benefit. So how you exploit, how you can find that new therapies come to the patient, that new products come on the market, that new guidelines and recommendations can be translated into policies. That's the exploitation that you need to show. So now we look at this plan for dissemination, exploitation, including communication activities. In short, it's called the plan for the tech. A plan is more or less a strategy. You need to show in figures what you want to do. You could, and I very often advise, you provide a table with information to whom you provide, with which method you provide what and how much of it. An example will be on the next slide. And here is a video how the evaluators are briefed to look and evaluate the impact section, the plan for the dissemination, exploitation, communication of your project. Have a look how they are briefed and try to answer all the questions that are asked in this video to the evaluators. But before I show you the table as an example that you could have, let's look at some definitions first. Results. Results can be so varied. Output is generated by the project. For example, data. For example, prototypes or skills of scientists, for example, or knowledge, or publications, or reports, or software, or pre-standards, or policy briefs. All these are results. So every project has several types of results, and each of these results can be disseminated in a different way. Dissemination means to bring the project results to the attention of targeted communities that can further utilize them. So the dissemination of data goes, for example, to scientists. The dissemination of prototypes could go into industry. The dissemination of policy goes to, for example, health ministries. So you have different result types that have to be disseminated to different target groups. And then it goes a step further. Exploitation is the use of the results in further research and innovation activities. For example, in the commercialization of a product or a service, or in the standardization of a new technique, or in policy making. And then the last part that is sometimes confused with dissemination is the communication. These are all activities promoting the action and its results to various audiences, so to the media and to the public. Communication can be extremely important when you want to bring an AI-driven tool or an IT tool or a new vaccine to certain population groups where you know that the reluctance and the mistrust is quite high, whether it's an old population or whether it's a specific cultural population. There you need to work on the communication, and that's again a different target group that you reach with your communication activities. Now, how could you show this in a convincing way that the evaluators can measure straight away, very fast, that you really reach all your requirements? You can do a table. You have a table with, as an example, what to disseminate and exploit, to whom you disseminate and exploit this, how is the method that you use, what are the barriers, by which partner in the consortium, and how much is your achievement and how you measure it. I have two examples, simple examples there, hopefully helping each of you to think in your project what you could do. Let's run this example with the product. So you have a product, which could be a model, an algorithm, or a specific material that you develop. You want to disseminate that to the innovators, to technicians, or to companies. And your new model, the method, is a new mathematical model. Let's just say that. The barriers could be national regulations, could be GDPR, could be anything that you need to identify. And if you work in different countries, you have to identify it in the different countries. By whom? There you show the excellence of this partner in the consortium and the expertise and the need to have this partner on board by saying it's this and this. Partner X, he's a mathematician or whatever expertise you need there. How much? The number of models or the algorithms that are being created or that are being taken up or can be taken up later on by the target groups, that can be measured. That could be an indicator. For another example, a service, you develop a training. You develop a training for clinicians or scientists or the health force in hospitals. Then you describe the method. The barrier there could be resources that you have to be sure that these clinicians have time to take this training. So, for example, you could say it's online to save the resource, to save them time, to decrease the barriers, or the language that you have to translate it to different languages. Then again, by whom? By a specific clinician or another partner giving these trainings. And then you could measure this by the number of downloads or the number of subscription in a certain training, or how well you reach your goals by a certain percentage of people that are being trained after this project on specific sites. That's how you could measure your indicators, your how you reach the impact. That has been now for the communication, dissemination, exploitation. The third part is the summary. There, I'm not going much into detail because the proposal template that each of you has available when you write the proposal has excellent examples in the back of it on hospital, airports and airport sites. It's something that we all understand, and the example is very clearly described. All I want to show you here is that this canvas summarizes the needs why the project has to be carried out, the results that you expect, how you bring these results to disseminate, exploit, and communicate to the different target groups, and how you reach the outcomes and the impacts. So you provide a summary of this section by presenting a canvas with the key impact pathways, and all of this is measurable and quantifiable. Do not be vague or you lose a lot of scores. And the canvas breaks the impact down into its component part. And apparently, really, if there is two equally strong proposals, these canvases are being compared and they need to be super strong and super convincing. These have been the three parts of the impact. As Nicole mentioned in the excellence sections, there is a lot of social sciences and humanities flagged topics. You may be active in one of these topics and you may think, how do I involve someone from social sciences and humanities? Because maybe you are thinking of a philosopher, you are thinking of specific social sciences and humanities expertise that may not be needed in your project. But there is so many different expertise in SSH that could be of added value to your project. And I can convince you for nearly every project, there is SSH flagged expertise that adds a new and more value to your project. Have a look at all this. SSH flag topics means you need expertise in, for example, education or political science or communication or psychology, philosophy, culture, ethics. Just to give a few examples there, let's go back to the example of developing a vaccine. And there is a lot of skepticism in many different cultural groups or in different groups of the population. So there, if you have an expert in the different cultures or in the communication and in the education part, then you reach these target groups better and you covered SSH. Another example is very often in a project preparation project that you submit, you are asked to look at the costs of your new treatment that you may develop, and why this new treatment is better, or if it's not cheaper, why it should be used compared to already existing treatments or drugs. Then you need the health economics, and that's also SSH knowledge. You have here at the bottom a link how evaluators are briefed with excellent ideas across all research fields, and you see how the evaluators are asked to look at your proposal and to answer the SSH flag question, whether you answer this, whether you have the expertise on board. This has been the SSH aspect. Now we are coming to the evaluator comments. Evaluators, it's always 4 to 6 evaluators that read the proposals, that have to write a detailed report for all 3 evaluation criteria. And the comments that we have on the next 4 slides are thanks to upgrade, thanks to the evaluation summary reports that all national contact points have available. So some comments here on the impact. That potential barriers to the project outcomes and impacts are not adequately addressed. So, for example, regulations have just been ignored, or other barriers, language barriers. Then we look at the gray one. Concrete activities are not linked to dissemination targets. When you say how you disseminate, how many times you disseminate something, of course, you need to show via which channel, what you disseminate, and what the target group is, and to prove why you reach that many people. A more detailed and targeted plan is lacking in order to generate acceptance for this approach and adoption in the specific community. I think we mentioned that with the vaccine exam. The next one, the exploitation of the produced software is not enough detailed. Overall in the project, avoid to be vague. Be as specific as you can, because it's easier for the evaluators to judge what you want to do, and do not be vague or you lose marks. Not enough measurable indicators to monitor progress, and target audiences and associated actions have not been identified with sufficient granularity. Again, be as specific and as precise as possible. Then we come to the next one, evaluators' comments, project pathways towards impact. There is I summarized 5 more, provides supporting quantitative detail for the scale and the likely timeline to realize the project's outcomes. You have to show that this is realistic. And we will look at that later on with clinical studies or clinical trials. You really have to have a realistic timeline in order to show that your project outcomes can be achieved. And that's why it's up to the consortium to decide how long your project will run. The wider impact, social, scientific, and technological impacts are addressed only at the generic level, and insufficient key performance indicators or quantitative measurable indicators are provided to assess the stated impact. If you need help there, contact your national contact points or contact your colleague, and make sure that you don't submit an impact section that has very generic indicators. They won't be good enough. Measures to maximize impact, elaborate the exploitation plan in detail. Do not omit explaining in detail the strategy of your intellectual property management. And for the regulatory barriers, the applicable regulations and mitigation measures should always be in detail shown how you mitigate these risks. Now we come to my last slide before the word is for Ariel, our evaluator. The do's and don'ts that I would like you to bring home as a key message. Be concise and precise as much as possible. Don't be vague. Address the impact in the short term, meaning as long as your project lasts, and in the long term. And also address all the outputs in the topic text. Write an excellent summary, an excellent canvas. Do not define impacts in qualitative terms only. You will lose a lot of points. Do not omit explaining the means of delivery of end results to users. If you say that you will reach certain end users, you always have to show the channel, via which channel you can reach them, and why should they be interested in your results. And to convince that this bridge is fully open, this communication is working. Do not be vague regarding targeted stakeholders. Name them, mention them, give them a size, how big these stakeholders are. This brings me to the end, and I would like to give the screen to Ariel Beresniak. Ariel will now present his experiences as an evaluator. Maybe we have questions and we have some time for questions. We do the questions, I would suggest, after Ariel.
Sasha?
Yes?
Ariel is not here yet. We are a bit ahead of time.
Yes.
We can take, I propose we take some questions.
Yes,
Perfect.
and it's excellent timing because there are some questions to what you just presented. So if you, we can spend just a few minutes of those.
Let's do that.
For example, for the impact if the impact by definition is for long term, how can we assess if impact by definition is for long term, how can we assess it from our research project? Or we just state the dimensions the project could be beneficial?
Yes, it's of course quite hypothetical, but you mentioned how the project's results can be beneficial, and you can, by the meaning of long term, you can upscale it. If you show that your output and after duration of the project, let's say in 4 or 5 years time, let's say that you develop a new treatment, and you already justified that you have clinicians that will use this treatment in certain hospitals. Then you can upscale it by saying that these hospitals will use this treatment in the next 10 years and how many more patients they will reach in the next 10 years. Then you could also say that by trainings between clinicians, they will upscale it to more hospitals in their countries. And that's how you show the wide effect. And then you can link it to the cost effectiveness or to the less hospital stays due to the new treatment, or you can link it to any type of these figures that you can that makes sense in your example.
Okay, there's another question that goes a bit in the same direction. So it says, Sasha mentioned that the expected impacts related to the destination text and the expected outcomes related to the topic text. I'm curious to know if the evaluators are approaching it in this way in their evaluation, as the destination text is usually much broader than the topic in question.
Very, very good question. And there is no one answer to this question. Every evaluator probably deals a bit differently with it. And also the evaluators are briefed. They are all briefed via these videos that we showed you. But then they're also during the moderation with the scientific officer, that's in the last round of the scoring of the project. It's also a question how the moderator, how much emphasis they put again on this bigger impact. But they're all the evaluators know about this knowledge. They will know it during the evaluation process, but how much they will implement by looking at it is a personal. Not everybody will do it the same way.
There is one more that's specifically for the impact section. So it says, you mentioned the dissemination, exploitation, and communication. Should it be in one table altogether? So I think, so this is a question from Daniel. I think what he means is one table in the summary section.
In the canvas. In the canvas, you have it all in one table. The table that I showed you in the impact under the plan of the deck is just an example. It's just a nice example to bring information together, and it's not complete by all means. So it's up to you how you put the data into nice tables, or you can also do it in a text, but a table is easier to look at and to measure for evaluators, all your indicators that you will have to produce. But in the canvas, that's the summary, that's the 2.3. There you have no choice. These columns are predefined, and there you put your information in. But maybe Nicole would like to add something to that in case there is another aspect how this question could be answered.
I don't have additional comments.
Okay.
Thank you.
Eva? No. Are you?
No, but I was going to say, if we still have a bit more time, we could look at some of the questions that are a bit broader. So there is a question that says, how do you recommend to co-create with civil society? I clearly think about patient association. What kind of exercise should we be doing to engage with them since the beginning of the project? I think this is a real challenge. Usually researchers are very busy writing the project and are not necessarily thinking about engaging them from the beginning. So do you have some tips on how to engage with or co-create with the civil society?
Go on, Nicole.
Yeah, I would say this is a very good question. And Vanya, you put it to the point. It is difficult to engage civil society but it's critical if it asks for instance, typically the patient associations. It's very good to involve them in the project and not just in an advisory board or 2 or 3 points, but that they are part of the consortium, and how to engage them. I don't have the magic solution, but it's critical to have them on board from the beginning so that they can give valuable input. Sasha, do you have more comments?
I would have said the same. It's important to give them space from the start. Yes, the scientists don't have it on the radar very often and have their own goal, but this is why this text comes more and more, that this co-creation is a must. This co-creation is a must from the point of view that also the setup of the project is differently when all the stakeholders are talking and planning at the start together. So it's at the start not comfortable, but it needs to be changed, that we bring all the stakeholders on board to discuss a project outline.
Do we have time for one more? It's nice. I see there are questions coming in. So
I see that Ariel joined. I will make him panelist.
And I answer one more question.
Okay, so here it goes. Are there policy evaluators to examine how the project is aligned with the EU policies? I'm not sure if scientific evaluators are aware of these points.
That's a very good question. It's not the evaluators, as I said, there's between 4 and 6 evaluators per project, and they are not all academic scientists. Depending on the topic, they can be CEOs, they can be innovation experts, they can be from the European Medical Agency. They're actually often there. They can be clinicians, and they can be people from health ministries that can look at this. So depending on the topic focus, the expertise of the evaluators are going into the direction of policies.
Excellent. Then I think I hand it back to you, Nicole, for...
I just have another comment concerning evaluators. It is important to wisely choose the keywords, because they will determine which evaluators will be asked for when you make your proposal. So think about meaningful keywords.
Thank you. And now I would like to welcome Ariel Beresniak. As Nicole already said, he is evaluator. He is also CEO of Data Mining International, physician by trade, but specialized in public health and has a vast experience in education and economics. He also worked as the advisor for the WHO and has a lot of health technology assessment and health economics knowledge. He also coordinated the project. And now I thank Ariel very much to be here and to take your time to share your experiences with us and to give the people listening here that are preparing proposals some tips what they should be careful in when they are preparing their strong proposals. Ariel, we don't see you yet. I don't know whether you would like to put on the camera or not. And then I give the screen to you, and I thank you for taking your time.
Thank you very much, Sasha. Can you hear me well?
Yes, we can hear you very well. Thanks, Ariel.
You. So I think that my camera is locked by the organization.
Yes, that is possible. I had that at the start as well. Nicole, can you do that?
Whatever I have on this slide to present, so you don't have to see me.
Ariel, good afternoon. I made you co-host now. You should be able to switch on your...
Yeah, you are. Perfect. Thank you.
Perfect.
Hi, everybody. Hi, Nika. Thank you very much for inviting me. It's always a pleasure to talk with colleagues and to interact with you, because we are learning every day in dealing and handling with European projects. I will share my screen. So I don't think it works now. Ah, yes, maybe. Okay, can you see my first screen?
We can see it. Yeah.
Great. So as an evaluator, since the COVID period, we are organizing the evaluation like this workshop remotely. And before the COVID, we were invited in Brussels during 2-3 days all together. It was a big organization to invite all evaluators, meeting rooms, hotels, and everything. And now it's much more light, and it's also people to be appointed experts from all over the world. And it's not rare to have a colleague from USA, Japan, anywhere in the world participating in the evaluation of the European project. So it's not only European experts, it could be experts from everywhere. So my background, I'm myself MD. I'm medical doctor by background. I'm specialized in public health, infectious disease, with a PhD in applied mathematics and economics. And I'm also accredited to supervise research and supervising PhDs in public health and health economics. I'm acting as CEO at Data Mining International, where SME, independent agency, research agency. We are specialized in value demonstration, advanced data analytics, outcome research, and any advanced methodologies. This is our involvement in a European Commission project. Some of them we have been coordinator. For example, the first one to test the methodological robustness of one specific indicator, the quality used in public health and health economics. The FLURESP also was a pandemic in influenza, but also COVID. EHR4CR, Semantic HealthNet, Value eHealth are projects specialized in e-health, so electronic health records. The ASSET project was a project about also epidemics, and the Remedia project is ongoing. It studies the impact of the exposome. The exposome is any environmental indicators in a pulmonary disease, and I will be able to share with you some of our assessment as an example of the excellence and impact and all the note we have had with this project, because I'm not able to share with you the assessment of the project, but the project successful that is still ongoing, and I'm participate as partner. Of course, I'm free to share with you as an example. So I've been evaluator for different programs organized by the European Commission, either IMI initiative, so it's a program involving also both industry and the Commission, and also of course academic and private partners, H2020 and now Horizon Europe. I suppose that you have been already briefed about the evaluation process. From the evaluator perspective, this is in 3 stages. The individual evaluation reports consist on evaluating 10 proposals by evaluator. So the last time I have received 10 proposals and I've been asked to fully assess the 10 proposals, and 3 evaluators are focused on 10 proposals only. So if there is 100 proposals for one topic and 3 experts by 10 proposals, you can imagine that 30 experts are appointed to rank and assess 100 proposals about. Then once we have remotely assessed the 10 proposals, we have explained everything individually. We need to draft a consensus. So one of the 3 experts is appointed rapporteur and collect and synthesize the assessment of the 3 evaluators. And then we discuss all together with the European Commission officer to draft a common consensus report. Sometimes the consensus is easy, sometimes the consensus is not easy, and there is sometimes discussion in a criteria for each project. Then the most difficult part is the final ranking of all proposals. So imagine 100 proposals for one topic. So we have only assessed 10 proposals, but we need to rank 100 proposals. So then we organize a meeting with all the evaluators. So for example, 100 proposals, we are 30 evaluators online with a project officer, and we're trying to rank the 100. But of course, there's a lot of similar notes, and I will explain to you how the hierarchy, the ranking is done at the end, proposal by proposal, in order to have the first one ranked with the last one. And it's very difficult to be consistent, but I will show you some of the criteria. So we received some guidelines, for example, to provide a clear feedback on the proposal weaknesses and strength, and to identify shortcomings. So shortcomings is okay, we can deal with shortcomings, but if we identify one single weakness, we should not be below the threshold, and then the proposal is excluded because below the threshold. But whatever, it will be included in the final ranking, but not as a potential winning project. So it's very important to understand the difference between shortcoming and weakness, because sometimes it's not very clear also in the mind of the project officer or in the mind of evaluator. So there's sometimes a lot of discussion to consider if some negative point of the proposal will be a shortcoming or weakness. If it's shortcoming, it could be a minor shortcoming or a major shortcoming, but we can deal with, we explain. If it's selected as weakness, unfortunately, it's totally eliminatory. Then we need to explain, but we don't have to make recommendation for improvement. So we can criticize, but we cannot be constructive. So example, we expect that would be much more explained, or we imagine that this will be developed in this way. So no, we just explain this is a shortcoming without making any recommendations. So when we score also, we need to verify that the wording and the chosen attribute match the score. Sometimes there's low score with a good wording, and sometimes a bad wording with a high score. So everything need to match, at least individually at the beginning. Then I explained that all evaluators discuss how we can construct a final consensus report. Then we need to rank all the proposals together, even ranking the proposal we didn't have the opportunity to assess. But for that, we have criteria. So the first criteria to rank proposal is to rank first the proposal which address aspect of the call that have not been covered by more highly proposal. That means that if the proposal with a little bit more originality, so addressing some original aspect, and the other proposal didn't address, this proposal will have more chance to be ranked in the first part of the ranking. Then the score for excellence is considered better than impact. So if a project has 5, the maximum score in excellence, and so for example 5 in excellence and 4 in impact, it will be ranked at the end better than the excellence 4 and impact 5. So it's better to be excellent. Then the gender balance. That means that if the coordinator has declared more women in the team than another project, it could be considered better. So it's very important to well describe the value, and anything who can describe a well gender balance can be considered very importantly at the end. The geographical diversity is also important. If there is only partners from the same country or the same group of countries, for example, Belgium, Luxembourg, and Germany, it's less good that a more wide diversity. And after that, all the other factors set by the panel. But you are here the hierarchy for the final ranking, and it's very important to work on this particular criteria, because this will determine the winners at the end. Then, what about the topic? It's very important to consider that a topic is an arbitration between the representative of the 27 countries. So imagine a meeting with the 27 countries with the objective to construct a topic, a call. And each representative for each country try to push the call in this direction or the other direction. For example, in Germany, if there's a very good and very robust epidemiological registry, they will try to say, oh, we privilege it, we want, for example, a retrospective study using registry, because they know that they are very well positioned in registry. If another country, for example, Hungary, is very expert in odontology and clinical trials, they want to push clinical trial. This explains why a topic, a call, is very difficult to address, because it's the aggregation of the willingness of every single member state. So at the end, it's very difficult to address all ideas, because the topic represents and all the ideas of all of the 27 representatives of the member state before validating this call. Then this is an example of a call topic about a rare disease, for example. So it should be very important to assess each word, each phrase. So, for example, here is a proposal of highlighting what we think will be very important. For example, establishing multidisciplinary collaboration. So we need to focus on multidisciplinary, integrate harmonized data from multiple sources. So we need to address that. Understand the pathophysiology, heterogeneity of the rare disease. So we need to explain that. Develop, utilize relevant preclinical models and/or innovative tools, technologies. Applicants should describe how well the model replicates the pathology. Develop and/or execute innovative clinical trials designed for small population, robust surrogate and clinical endpoint, carry out preclinical proof of concept. So every sentence is important, and the final proposal should address all of this highlighting. If not, they could be considered as a shortcoming of even worse weakness. Then my recommendation is to track and select every keywords and every key sentences of the call topic, to address these keywords and these key sentences of the topic, and imagine a story to make the link between all these keywords and all these key sentences. I recommend to help the evaluator with to explain, for example, with a table. Okay, this sentences is addressed with this aspect. These sentences or this keyword is addressed with this aspect, or this color figures, or this table address that and that and that in complement. So using colors, tables, graphs, anything which could show that we have totally understood the topic, and we master the area of the topic is very important. I recommend to select one single writer in order to have one homogeneous and consistent style. It's very difficult to show and to assess a very difficult heterogeneous style when reading a document, even if, of course, the word package leader could write their own part, but at the end, everything should be reviewed and rewriting in a consistent style. And also, a proposal is not a demonstration. A proposal is a promise. So we need to be convincing with the promise. I recommend also to find and be creative about the name of the project, to something easy to memorize, because sometimes we see a lot of project acronym which are the first letter of the full sentence. For example, ACTHOMG. It's very difficult to pronounce and very difficult to memorize. Or other acronym, for example, My Health, is very easy to remember. And then there is maybe it's not conscious, but it's create a positive mind behind the project, because the acronym is clear. So we imagine that all the demonstration behind the acronym is also clear. So I think you have been aware about how the scoring is done: 0, 1, 2, 3, 4, 5. So each of the criteria, excellence, impact, and ability of the consortium, is scored between 0 and 5, and with a threshold which could be 3.5 with 4 differently. And it's very important to whatever avoid shortcoming or weakness. So a proposal without shortcoming or without weakness will be always score very good. So it's a reason why it's important to track any potential shortcoming or weakness. Is of the conflict of interest is important to mention, because you can imagine we have, for example, for 100 projects, 30 evaluators. So of course, in a very focus area, everybody knows everybody. So some evaluator could know or could have the experience of sign an article with some of the organization which apply for this project. This is a potential conflict of interest. And of course, there is a process to declare for each proposal if we are in conflict of interest or not. But what is strange, according to the European Commission practice, that if we are a conflict of interest for one particular project, we are not excluded from the evaluation. We are just excluded from the evaluation of this particular proposal, but not excluded to assess the other proposal. So of course, if we want to push one proposal, it's easy to lower the score of the competition. So this is very strange, and It works like that. Honestly, ethically, I'm not very happy with this approach, because it happens sometimes that okay, one evaluator is excluded from one proposal, but it's not excluded to assess the other, and we can feel that it can be very hard and criticized with the competition. I think it's not very fair, but it's how it works. What about my recommendations? I think that a best consortium size could be between 7 and 15 partners. A consortium with 5 partners, it's quite low. A consortium with 25 partners, it's quite heavy. This should have a good balance between academic, SME, and maybe 1 or 2 industry. A good balance also with geographical diversity of European countries, at least one of the north, one in the south, one in the east, one in the west. Associated countries are welcome, like Switzerland or Norway, or also third countries. I also can share with you that the consortium, including one national, European, or international organization, is very well perceived. For example, the one national agency of some countries, one ministry, WHO, or any organization sounds well, because the evaluator think that, oh, this could help the impact, and it looks good in the consortium. So if you have some friends working in some of these organizations, please don't hesitate to ask this organization if they want to join, and you will be surprised that every organization in Europe are committed in some of the European Commission projects, and it's well perceived, at least for the consortium balance. Each partner should be able to present at least 5 scientific missions to show the scientific robustness of the partner, and to avoid some pure consultancy company. There is a lot of strategic consultancy company, you know. They can also can do a good job, especially in presentation, a good PowerPoint, but if they are not scientific based, it's not well perceived. There is a high interest to also appoint one administrative partner for handling the submission. There is a lot of SME specialized to do the administration of the project. This could be a lot of help for the coordinator, especially if the coordinator is not organized to handle of the administration. You can appoint one partner just for that. The coordinator writes the proposal, supported by the work package leaders, but I'm fully a fan to have one single writer with a good writing skill. Then it's important also to develop the potential work experience or synergies between partners. If not, you can just imagine what could be the synergy, because the European Commission will not check if the synergy has been done or not. So imagine that this partner have a common interest for that, to show some synergies and experience to work together. And I would say my main recommendation will be to obtain by any way a copy of a successful proposal as a model. This could be of a lot of help, because there is a lot of generic description in the proposal. For example, the gender issue, the impact, the financial, the resource, the explanation about everything. And it's very difficult to imagine from scratch how to write this kind of sections. So if you have the model, you don't have to copy, but why not if you trust? But you have the model of a successful proposal. You have a very good example of how it has been written, and you lose a lot of time and you improve significantly the chance to be a very high proposal if you know how is looking a good proposal. And then because everything is submitted electronically now, there is sometimes a lot of bugs, problems. If you can submit 2 days before the deadline, you will have the time to fine-tune during the 2 last days without taking the risk that by 1 minute you should be behind the deadline because your computer crashed. And this was my last recommendation. Thank you.
Thank you very much, Ariel. Thank you. Thank you very much. We had a few questions, but we run totally out of time. Maybe just one question that I read in the FAQ, that there was a question about these 5 publications that you have at the last slide. And then the question was, but an NGO or a patient organization that is encouraged to also participate, you don't mean that with the public, you mean the publications for the academics. Could you just specify, because you raised question remarks.
Yeah, this is a good remark. Yes, I confirm. So a patient organization is also a very good potential partner. There are European patient organization. They are very skilled and also willing to participate in consortium, and it's good to have them. And also this also allow me to say that sometimes they participate in competitive proposals, because it's not forbidden that one partner participate to competitive proposal. Yeah, especially patient association, because if a proposal is focused on multiple sclerosis, for example, and one consortium involved the European Society, the European Patient Association of Multiple Sclerosis, you can imagine that every proposal, every consortium want to have them. So it's a good partner, and they can participate to many proposals as well. And of course, they are not doing their 5 articles, but more and more time, I know patient association also co-authors of more and more articles.
Thank you. Thanks very much. I hope that answered that question. Thank you so much. We will have another Q&A session at 4:05 after now the implementation part that Nicole will have. If you feel and have time to dial in or stay on, because there was more questions for you. Otherwise, thank you.
Thank you.
Nicole.
Thank you.
Thank you, Ariel.
Thank you, and thank you from my side, because you already tackled things we will see now after the coffee break about the implementation, the consortium, the work packages. So many thanks for having addressed this. But before we move to the implementation section, we will now have 10 minutes break. And it's 38, so 40. 10 to 4, please, we will reconvene. Thank you. See you in 10 minutes. Eva, you can stop the recording. Welcome back, and congratulations, you successfully went through section 1 and 2, and we are now looking into section 3, quality and efficiency of the implementation. If I can move the slide. Yes. And in section 3, we will answer the how to achieve the objectives we defined in the excellence part. Section 3 has 2 sub-chapters, the work plan and resources, and on the other hand, the capacity of participants and consortium as a whole. The evaluation criteria for this section are, on the one hand, evaluators will look at the quality and effectiveness of the work plan, the assessment of risk and appropriateness of the effort assigned to work packages, and the resources overall. You remember Ariel showed the evaluation summary report of one of the projects he's involved in, and the comments were that the work efforts were well assigned. Then evaluators will also look at the capacity and the role of each participant and the extent to which the consortium as a whole brings together the necessary expertise. So each partner, is the partner valid, and all together, do they cover all the needs to do the work described in the project? And you will ask to provide a brief per chart, which shows how the different work packages are interlinked and work together. It is nice to have it in a chart and diagram so that it's easily recognizable how work package 2 works with 3, 4, and 5, and which are directly interrelated and others less. You should also provide a Gantt chart. There, it identifies the dependencies between the tasks. You should list the work packages, but also the tasks in a timely manner. And it will identify the task start and end dates, and will work out through the whole project duration. And one tip, these Gantt charts are usually quite big because you have to list all work packages and tasks and during the whole duration. So please make sure they are readable. Don't use too small fonts because then it's useless. You really have to ensure that even if the proposal is printed, it is readable. We spoke about work packages. Here, you should, for each work package, describe who is the work package leader. We had the question recently, there can only be one leader. And then describe the objectives of this work package and the work that will be done. And the objectives are the goals of the work performed within the project in terms of research and innovation content. They match the objectives you have at the beginning in your project. And these will be translated into project results. One word about the amount of work packages. If you have a lump sum project, you should have work packages that fit the reporting period, because in lump sum grants, you get funding for finished work packages. So here you have to design the work packages so that you can finish them for the reporting periods in order to get the money. And you are allowed to increase the number of work packages. For instance, typically the management work package should be split. And here you can describe the work in the first work package, and then in the second or the two subsequent work packages about management, you just state that it's the same as the previous work package. The same for the dissemination, communication, and exploitation work package. Here you can split it also, but describe the work you will do in, you don't necessarily do the same thing during the whole project duration. So here you can fit the description if you do more communication or which activities you do in the first work package and then in the subsequent ones. You will have to design deliverables. And a deliverable, you have the definition here, is a report that is providing information to ensure effective monitoring of the project. There are some mandatory deliverables. We have seen already the data management plan that is asked for at month 6, but also the plan for dissemination and exploitation, also at month 6. And there might be other compulsory deliverables according to the topic and the project. And we recommend to make meaningful and feasible deliverables, to have at least one per partner organization, and to distribute them evenly during time, because you have to provide this to the European Commission. And if you have 10 deliverables at month 6, it might be difficult. So if you can distribute them for earlier or later, it would be good. In addition, you will have to design milestones. And sometimes we see many milestones that are more deliverables. And the definition here, milestones are control points in the project that help to chart the progress. So they may be a critical decision point. So at the time when you have the prototype ready, or when you have the results of the survey telling you if you want to go option A or option B, these are milestones. They can be also an achievement of a key deliverable, and they are contractual obligations. They will be monitored, deliverables too, and you have to provide these. So we recommend that the achievement of a milestone is verifiable, that you have metrics, and not every work package needs a milestone. Only indicate those that are necessary. And we say for a project of 3 years duration, about 5 milestones are adequate. Then you will also have to address the critical risks. And a critical risk is a plausible event or issue that could have a high adverse impact on the ability of the project to achieve its objectives. It is to answer possible concerns of the evaluators. What could harm the project implementation? And you have to name an appropriate number of risks and show that you are prepared for these. Do you have measures to reduce the risks? Do you have a contingency plan? And we recommend to avoid fake risks of low likelihood and low severity, just to have one. And we also recommend to pick meaningful ones and show that you are prepared, so that you show the evaluators that you are aware of what could go wrong, and that you have a mitigation plan. And it's sometimes difficult to distinguish between risks and barriers. So here are the two definitions. Risk is a plausible event or issue that could have a high adverse impact on the ability of the project to achieve its objectives. On the other hand, the barrier is an issue arising from factors beyond the scope and duration of the project that may determine whether the desired outcomes and impacts are achieved. And to give you a bit of a flavor, I prepared a few questions. There are 3 questions. I will launch now a poll with questions, and I will ask you to answer if it's a risk or a barrier. So let me look for Paul's. No. Here. So please answer. So the first question, ineffective communication between project management and consortium. Is this a critical risk or barrier? I see you understood. I let you answer. I'll leave you a few more seconds and we'll then end the poll. Okay, I will end it now and share the results. Do you see it? Eva, do you see the results?
Yes, I can see the
we see
results.
it.
Thank you. So the ineffective communication between project management and consortium, yes, it is a critical risk. It is something that can happen during the project. And here you should have a mitigation plan, say what you do if this happens, and show that you are prepared for plan B. Second, developed medical device does not meet the requirements. Yes, this is also a critical risk. And here again, you should have a mitigation plan. What will you do? Can another partner take over? Do you need more time, but can you buy it? Or do you have measures to do this? And question 3, change in pharmaceutical regulation. This, yes, the majority recognize that it's a barrier. This is something that is out of the scope of the project and might impact the project too, but is not a risk. You don't have to you cannot provide a mitigation plan. I will now stop share. Thank you for your cooperation. And now we will go over to the second sub-chapter, the consortium. And it is not a must, but it is nice if you provide a table with each partner and the different skills that are asked for, and show how the expertise is shared or distributed among the consortium. And Ariel said it's nice to have partners all over Europe, in different countries. This is true. I would say that still they have to make sense. Don't choose a partner in Ireland just because you want to extend your scope or the number of countries you're covering. each partner must make sense, must have the relevant expertise and make sense in the team, in the consortium. And here again, from the evaluation summary reports we picked meaningful or often recurring comments from evaluators, such as in blue here, effort distribution among partners is rather imbalanced. If one partner has most of the person months and the others are not so much involved, it has to be explained. And the risk mitigation plan is not sufficiently described. So what will happen if a risk arises? The evaluators are not sure that you will be able to continue the project. And the third comment, nearly all partners contribute to each work package. This raises concerns on targeted allocation of competences. So it's nice that partners are involved in different work packages, but according to their competences, they should not all be in all work packages. And in summary, some do's and don'ts. You should plan your work in a concrete and precise way. You have to provide a PERT diagram with the interrelation of the different work packages and provide a Gantt chart. You should demonstrate that the consortium has all the necessary competences and that they are balanced. You should assess the risks and suggest how you will overcome them, and speak with a single voice. You shouldn't plan too many deliverables and milestones. You should distribute them evenly. Milestones should make sense. Don't have too many. The same for deliverables. And don't be vague when describing the tasks. Like for the whole proposal, be precise, be detailed. This will really help the evaluators to know exactly what you are doing. Don't include partners with no significant role and tasks. And don't have an unrealistic timeline in the project. And also the clinical aspect is important when you recruit patients. It takes more time usually than thought. So here also you should plan your recruitment plan. Thank you. With this, I'm at the end of the third part, and we can go over to the questions and answer session.
Good.
I will stop share for the moment.
I will check. Okay, so we have a first question and it's about lump sum projects. So the question is, in lump sum projects, when we split a work package, do we need to have separate deliverables for each work package replication and each task replication? So I think if you split, for example, a management work package, you then need to do multiple deliverables.
But you keep the deliverables you would have and you assign them to the work package that is involved in. So if you have reports at several time points, you assign them to the work package that is involved. And you don't have to replicate deliverables. This should be avoided. You shouldn't have too many, and you don't need for each work package a defined number of deliverables.
I don't know, Sasha, if you have another comment. Otherwise, there's a question that's a bit similar to this that maybe will clarify, which says, for example, for the work package for project management that would last for 4 years, equal to 3 reporting periods. If I understand correctly, you don't present this as one work package running from month 1 to month 48. Rather, you present as 3 work packages, but put the same text for each of these 3 times.
Exactly. So when the task is exactly the same, we got the recommendation that you put a description in, let's say, work package 1, and then for work package 2 and 3, which are exactly the same tasks in management, you can say same as above. You don't have to save space. You just say same as above. But if the tasks are slightly different, as in the communication and exploitation, there you can specify in the 3 work packages exactly what you do.
And maybe if I may complement.
Please.
The reason for this division is that the money flows, that there is no shortage of money because the money in the lump sums is being paid out when a work package has achieved all the deliverables, and only then the money is being paid for that work package, and then the next one can start. And that's the whole reason why these work packages can be split. And in the management work package, when you have, for example, a deliverable of a specific number of consortium meetings or conferences or workshops, then you adapt your deliverables to the time span that this work package is running, and you say what you achieve in year 2 and 3 of the project. So it's very similar to the first work package of management for the first 1.5 years, but the deliverables have a different timeline and are not exactly the same, but are the ones that you want to achieve in this time period. I don't know whether I made it more complicated now or clear. My colleagues can complement.
No, I think that's fine. It's clear that there are quite a lot of questions about lump sum projects and how to construct this. So maybe in the follow-up material, we can also include the links that the Commission has provided on how to set this up so that the documentation will be available.
Yes.
I tried to, let me see, get a next question. So, and this question is also about the work plan. Are there specific managerial positions that we should include? Is it important to mention the specific person that will take the role or just the organization?
So when you have the work package description, it's the organization. It's not at person level.
Clear. Okay. Then then there is a question that relates to what you were saying, Nicole, with the barriers and the risk. And the question is, if it's not possible to provide a mitigation plan to a barrier, how do we talk about them? Do we simply present them without a solution in the project proposal?
Oh, this is a good question, and I don't have a good answer. Would Sasha, you have a comment here?
Oh, that kind of weakens your project, and it's always good to have some mitigation measures, even if you have some unpublished data or some pilot study that has shown a specific direction. You can mention that to just not have too much of a risk, because the risky type of research, there is other programs for that than in the societal challenges. So you should have some idea why it should work out. And if it doesn't work out, you have to explain what, even if a study isn't has a positive outcome, this is an outcome too, and that needs to be explained then, because then this does not have to be repeated by other scientists. That's what I would have added. Maybe Eva has something else to add.
No.
No.
Not, I think the same. You address it and you show the evaluators that you're aware of it and you have thought about it. And if it's out of the scope and out of your hands of the project to have a mitigation, because it's a barrier, then you present your knowledge about it, and then you try to make the best mitigation you can, even though if it's not a mitigation as you would one of your risks in the project. So always address it, not avoid it. Don't just push it under the carpet. I think that's the main point, because the evaluators will know. They will figure it out. Then there is a question about the PERT. So where would you recommend to place the PERT diagram in the application? I would have placed it in the excellence section when describing the overall methodology, but can see that it gives more meaning to display it in the implementation section.
So yeah, normally it is in the implementation section.
Yes, I think here maybe also it's a requirement that that's where it's in the template in the implementation section. And of course, when you present your methodology, you present what tools and methods you will use, but how they are structured in the proposal, that comes in the implementation. Let me see. Okay, it's again about lump sum projects. How many work packages can be in the application?
So there is, they say you shouldn't have too many work packages. One of the rule of thumb is 1/3 more than for a normal project, because you will need to split them, but try to keep them to a reasonable level.
Okay. Yes, so also about lump sum projects. For example, if you have a long project for 5 years with 4 reporting periods, there may be some very big work packages. And so the question is, this means that almost all partners will work in all work packages. Should we avoid that?
Mm-hmm.
Is the question. Is that something to be avoided?
I don't understand why all partners work in all work packages, because you're involved in a work package and let's say for technological development of a device, and instead of having it the whole duration, you split it. But the partners involved in this work package will not necessarily be involved in the communication work package or in the management work package. So you look for each work package how to split it, but the distribution of partners in the work packages before they are split should be normal. Is this clear, or?
I think it's as clear as we can get it now, but I think also our recommendation, of course, is always, if you're in doubt and you're preparing your proposal, contact your national contact point who can give you individual advice on how to structure your project, because now we answer more generally, of course. Okay, let's go to the next one.
Maybe just let's do one more and then we have to do this last presentation.
Then I have to find a good one. Okay. Is it better to present the consortium before the various tables in section 3.1, or can you fit the tables section 3.1 and put section 3.2 at the end? So you should, sorry, I think this is clear that in the template section, the consortium description comes after the tables. It's the last part in section 3.2. Do you want one more question or continue with this? I can see there are still some that are to do with how to structure the work plan. So I think that's a good topic for follow-up, how to do that for lump sum projects.
Then
I would suggest that I start with this.
Yes.
So stay on, the 172 people that are still on board. We lost a few, but we lost quite a, but it would be nice if you stayed on, because you will be surprised how often this template applies to you, because it does not only apply to clinical trials. So let's start with having a look when it has to be filled in. And the definition of the EU for the proposals is such as that the clinical study covers clinical studies, clinical trials, investigations, cohorts, and means any systematic prospective or retrospective collection and analysis of health data obtained from individual patients or healthy persons. So it's wider than some of you may have expected this definition to be. And it includes, but is not limited to, clinical studies. The bottom bullet point is extremely important. It includes interviews, surveys, all projects that collect or analyze data of humans, also not linked to any medical studies. That is important, and that's why we are looking at this template, which has to be submitted together with the proposal in many cases in health. So fill in this template when you plan to collect human data or biological samples, for example, for a phase 1 trial of a vaccination, for a new analysis of blood samples of a closed trial, for a clinical investigation of medical devices, of also survey on well-being, or interviews on specific behaviors or habits, or retrospective analysis of patient data. So for all these, the template needs to be filled in. This is how the template looks. You have access to it also where you have the proposal template, also under the funding and tender under your topic. Where a clinical study is required by the topic, it's compulsory. And for the others, you can always, you can fill it in. So it's the rule is you need to fill in one template for each study plan. So if you have several study planned in one project, you fill it in several times. And despite the many headings and subheadings that we will look at in a minute, you have to stick to the structure and address each section. If a section is not applicable, you describe that, you write it, and you explain it. So why is this template so important? Because it provides structured information to the evaluators. It gives applicants the chance to provide detailed information about clinical studies without page limitations. This is the only document without page limitations, and it's mandatory for certain topics. Mandatory deliverables for each clinical study. There is 3 of them, and they need to be taken then from this template and also be shown in the part B of the proposal. You have to show them in the excellence section. And that's why I will later on have a slide to show you that how well you fill in this template has an effect on the excellence, impact, and implementation score of your proposal. So let's have a look at the first one. The first mandatory deliverable is the study initiation package. Now, when we read this, it will be clear to you that this is specific for a classical study. And I show you the example how you fill this in on a less classical study when you do a survey. But first, the study initiation package is you need to have the registration number of the study in a registry meeting WHO registry criteria. You need to have the final version of the study protocol as it's approved by regulators or ethics committees. And you need all approvals required for the enrollment of the first study participant. As an example, when you have something else, when you do, for example, a survey on well-being, then your first one could be the survey is prepared and finalized, the ethics committees has agreed to it. The second one could be the target groups of the survey are defined, including the amount of people, the gender, the sex, and the countries that you will interview. The third one will be interviewers are trained and ready to start, and timelines are defined. So this study initiation package can be adapted, and you provide the information depending whether it's a survey, whether it's a clinical trial, but you have to provide the information. The next mandatory deliverable is the midterm recruitment report. That is due when 50% of the study population is recruited, including the number of recruited participants per site. And you need to mention any problems and how to mitigate them to compensate delays. Here is just a word of warning. Very often, the recruitment is the biggest problem in the working with interviewees or with patients or with people. And as soon as you see that you have a problem with recruitment and you will not achieve your numbers, do not wait until the midterm recruitment report. Signal it to the European Commission that you have time to take up new sites to come to get up with the numbers, maybe with other partners or other potential sites. This is extremely important because more and more the EU projects are not willing to be extended, that they give you more time because you're running out of recruitment, out of time to recruit the people. If you have a problem, flag it, you're not the only one. The last mandatory deliverable for each clinical study is the report on the status of posting results in the study registry. And this is irrespective of the successful completion of the clinical study. That means the summary results must be postponed in the registry, latest for the last months of the project, regardless whether successful or not successful with the design and the study was. It needs to be in the registry. These three mandatory deliverables then, of course, need to be taken up and shown in the implementation part and referred to in the excellence part. The template has many, many subsections. So there's the description of the clinical study, then there is the preparedness status, and there is the operational feasibility. And due to time limitations, just a few words on this description of the clinical study. There you provide the objective, you provide the study design, you provide the information on the population sizes, on the sample sizes, on the statistical power that you need to use. And you clearly state the type of intervention as it determines the regulatory and the ethical framework. Then the preparedness status, there you show when in the whole project duration the clinical work will start, and that you show that you know that before that you need the regulatory and the ethical approvals, and that this timeline is realistic and can be done. You also include, if you have scientific advice from regulatory bodies or from the European Medical Agency, you include that information, and you provide information of the sponsor, also in this preparedness status. The last one, operational feasibility, there you go into detail about your recruitment, how many people you think you can recruit per site. You have to give estimates of patients per site from the past for each clinic, for example, to show why your recruitment plan is realistic. You also there show how long it takes you for each country to get the ethical and regulatory approval, and you provide information on data management. There, it's what Nicole said about the milestones. So every regulatory approval can be a milestone because it shows the direction. It gives an indication which direction your project can go. And these milestones then, of course, have to be copied into the table 3.1 under the implementation. For help, there is a template in the webinar that I will have a link on later on. But how is the information in the template scored for the evaluators? So as I mentioned already, it has an effect on all 3 evaluation criteria. It impacts the excellence score because it's part of the methodology and part of how you set and plan the objectives, and that reflected very clearly in the template and the information you provide. It also impacts the quality and efficiency of the implementation because you show the operational feasibility, you show how the sponsor can work, how the recruitment is going, and how the different sites are planning the management and how the whole thing should be implemented. It impacts the impact score because you have to address all the barriers. You have to address how you reach the target group, how big the target group is, and via which channel, and the key performance indicators. So really the template, you have to write a strong template in order to have a strong score in your full proposal. We have this template, the annotated template, which is an excellent document from the Health NCP Net, and is on the website. And there is also a recorded webinar that provides you more information on what I just gave you in a nutshell, and have a look at it and see whether it's helpful to you, and otherwise you contact us, contact points. The do's and don'ts, to summarize, clearly state the type of intervention as it determines the regulatory and ethical framework that you need to tackle. Describe the governance of the study and provide details of the sponsor of the study. The sponsor can have a dedicated work package, then fill in the work package under the 3.1 work plan and the deliverables to it, and the deliverables to it. Be aware that the country-specific information is required and has to be provided for each country that participates in this clinical study or in a specific clinical study in the project. And the regulatory approvals are milestones I already mentioned. Try to not run into recruitment failure. Have a proper feasibility study and plan. Do not omit justifying site feasibility. Show how many patients of a specific patient group a site has per year to show that your recruitment strategy is logical. Do not forget end users or patient organization, patient involvement. Do not forget to list the 3 compulsory deliverables under the specific work package descriptions in 3.1. And do not forget to list in 3.1 in the relevant tables, the milestones and the risks. This in a nutshell, more in the webinar on the Health NCP project web page. Before we come to the conclusion, we open the floor for maybe 2 questions on this clinical study template, and then we come to the conclusion and to ending the webinar. Do we have any questions? We do, yeah.
Yes, there are. I will.
I can read them, or you can read them, Nicole, feel free.
No, go ahead, please.
I am reading them. If you have a clinical study, yeah, go on, read them loud, Eva. That's good.
Okay, let me see. So I think from the ones that are related to what you just presented, Sasha.
Please, yeah.
What means are allowed to encourage recruitment of patients and participants? Gifts or money?
Or patients. None. You have to, the informed consent form should be enough. But you can have a CRO that runs the recruitment. That's all that I have to say to that. Nicole, have you something to add? Because otherwise you run into dual use and you're not allowed to have that.
No, I think you cannot give money, and yeah.
No money and no gifts, because otherwise you have a dual use problem or a misuse problem that you have to answer.
Okay. Then the next question is, in my project, we will not recruit patients, but we will use cells obtained from surgeries in
Oh,
in
you need to find-
vitro studies. I understand the need of ethics approval and information consent for the use of the cells. They will be anonymized and no patient data will be stored or shared. Do we still have to include a clinical study annex?
No, because you use cells obtained from surgeries and you have to inform consent on that. And they're anonymized. Then it's an ethical. You need to fill in an ethical table as well, where you say that you have these cells, and then you have the ethical section that you have to fill in detail, but that's not the clinical template. Nicole, would you like to add something to that?
No, I fully agree.
And if you have doubts on that, contact your NCP. Yeah, we are running out of time. Is there another one that we should cover?
There are two more on the clinical,
Okay.
as far as I can see. So do researchers need to fill in a clinical study form if they work with leftover surgery cells where patients give informed consent to use their cells?
These are more ethical questions. You really need to provide in the ethical table and afterwards in the ethical section where your cells come from, and that you have to consent and how they are anonymized. And that is it. No, then you don't need to fill in the study template.
Okay. Then there's one more, which is for you to confirm if this is correct. So in a study on acceptability of a test would need an annex. A study on cost of implementing the test, for example, for the government, would not. Correct.
I don't understand the question. So a study on acceptability. That's more under the exploitation, how you exploit the project and how you want to go about with that and how you want to reach the government. That's IP issues and exploitation. That is not for me in the clinical study design. Nicole, you see that too?
I have no opinion on this because these are very two different things in my opinion.
Yeah.
Study on the acceptability. So if the test is what means acceptability? If it's suitable, if it's so clinical trial would be the test is suitable for the disease or.
Yeah. Why don't you write us an email and we provide some more information and then we can answer you in better because then we know more of what you are planning.
So I can see that there are more questions ticking in. So I think it's up to you if you have time, and otherwise
Seriously, complete the clinical studies form. These are very specific now, and they have a lot of information that we would need to answer them in detail. I suggest that you write to us an email and you look at the webinar of the study template, and we answer all your questions, but we need some more information on them.
Great. Then I would suggest, Nicole, that you do the concluding remarks.
All right. We leave the word to Sasha.
So here is a list of tools and links that you can use. It's the annotated proposal template. It's the Horizon Europe evaluation form. It's on Cordis. You find all the running and projects that have run in the past. Then there is a fact sheet on good social sciences and humanities integration practices. And as I mentioned just now, the annotated template on the clinical study. And we will provide one more document in the follow-up mail, the link to the lump sum webinar from the Commission. But as a final note, we would like to draw your attention to the Health NCP Net. That's the support network that navigates you through the European Health Research and Innovation funding landscape. On our NCP webpage, you find news and events. You find a lot of tools, documents, annotated templates, help how to find partners, and last but not least, you get the contact details for each national contact point in your country that you can contact for more questions. So have a look at this webpage and get the support that you need after this webinar. We hope this has been helpful to you. Thank you.